This skill is designed to evaluate your ability to manage an out-of-hospital cardiac arrest by integrating patient assessment and management skills, CPR skills, and usage of an AED. You arrive on scene by yourself and there are no bystanders present. You must begin resuscitation of the patient in accordance with current American Heart Association guidelines for CPR. You must physically perform one rescuer CPR and operate the AED, including delivery of any shock. The patient's response is not meant to give any indication whatsoever as to your performance in this skill. Please take a few moments to familiarize yourself with the equipment before we begin, and I will be happy to explain any of the specific operational features of the AED. If you brought your own AED, I need to make sure it is approved for testing before we begin. You will have 10 minutes to complete this skill once we begin. I may ask questions for clarification and will acknowledge the treatments you indicate are necessary. Do you have any questions? You respond to a call and find this patient lying on the floor.
As you just heard, in this scenario, you will be required to perform 2 minutes of CPR as well as attach an AED and use it according to your patient's needs. You will have some help that will be able to bring the AED if it's called for. This will not happen until later into the scenario. So as you approach your patient, of course, making sure the scene's safe and we have our gloves on, we will assess, hey, are you okay? We're looking for any signs of life, chest rise, breathing, or anything like that. Hey, are you okay? At this time, the evaluator will tell you that your patient is unresponsive, is apneic, and pulseless. So we would immediately expose the patient's chest and begin CPR. Somebody call 911 and get me an AED. 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Give 2 breaths. Do not stay off the chest any more than 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 26, 27, 28, 29, 30. Making sure that we get good chest rise. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Beginning my 5th set of compressions, I see my partner coming with an AED. Continue. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. AED is now on the scene. I'll have my partner to begin chest compressions. Chest compressions going while I get out the AED. As my partner is doing chest compressions, step 1, turn on the AED. Expose chest.
Remove all clothing from patient's chest.
Apply the pads while compressions are being continued. Pads are in place.
Pull red handle to open bag.
Stop CPR. We want to
Look at pictures on pads. Do not touch patient.
do not touch the patient.
Evaluating heart rhythm. Stand by. Preparing to shock.
We can actually be doing compressions while we're charging up.
Clear. Press flashing button.
Stop compressions. I'm clear, you're clear, everybody's clear, nobody's touching the patient. Deliver shock, immediately start back CPR. 1, 2, 3, 4.
And rescue breath.
And we'll be through with that scenario at that time.